So since we know we're going to do this, we're in supine, low to the table. Even if I raised her all the way up, I would have to be bending over. So we're gonna sit in our chair, sit on our rolling stool to take this measurement. Okay? All right. So movement is in the sagittal plane, right? So here's her movement. So I know the axis has to run this way in the frontal plane. Okay? I want her to scoot down a little bit because her shoulder movement's right here in this hole in the table, so I want her to be down a little bit. Okay? So I am going to take her through passive range of motion. Okay. And what I want you to remember about passive range of motion is every time we take our patients through passive range of motion or we have them go through active range of motion, they're stretching. Okay? So if we keep doing this over and over and over again, then we're not going to necessarily get a true account of what their range of motion is because we've gone through it multiple times and we've now stretched the capsule, we've stretched and elongated the muscle, etc. All the connective tissues are expanded. So keep that in mind when you guys are practicing and you're looking at your goniometers, right? And you started out with 174 degrees of range of motion, or even if you started out with 180 degrees of range of motion, but now you have 182, and now you or 176, or okay. So every time you do it, and you start second guessing yourself on your goniometry reading, okay, remember that every time you do this, you're stretching them. So it would make sense that your numbers would get bigger as you stretch. Okay. All right. So I would first take my patient through passive range of motion. Okay. So I know how much is available. Okay. Also, what am I checking? End feel. Okay. So I know how much she has by testing passive range of motion. Then I want my patient to demonstrate that for me. Can you demonstrate that for me? Now I'm visually observing how much she's using. Okay, active range of motion. Okay, so now we're going to start. All right, so I have my goniometer, and it tells me that the axis, first of all, how do we place it? The stationary arm should be close to the body, movement arm close to me. Okay? Numbers should be facing me. Legibly should be facing me. So if you ever put it this way, it's wrong. Okay? We don't ever want to have the stationary arm close to the patient. Right? We're reading it backwards that way. Okay? So the numbers should always be facing me clearly, and the moving arm should be on my side of the goniometer. Okay? All right. So my axis is where?
Common process through the head of the femur.
Okay. So here's your acromion through the head of the femur. Sorry, humerus. The other femur. Right? Okay. So here's the acromion process, and I'm looking, kind of gauging myself to see, am I in line with the other shoulder? Just a quick visual kind of an assessment. Okay, now I'm laying up against her, but I'm actually not going to lay up against her because she's got to move her arm. Okay, so I've got myself in my sort of alignment. So where is my stationary arm aligned to? Midline of her trunk, right? In line with her greater trochanter. Remember, the greater trochanter is below the pubic bone, or in line with the pubis. Okay, so her greater trochanter is down here. Okay, palpable if you can't find it. Visually, palpate for it. Right. So we want to make sure we're low enough that visually everything's in alignment. Okay. palm down. She's going to bring her arm over her head as far as she can. That will be my direction. So I'd like you to raise your arm over your head, and as you do so, I'd like you to bring your thumb over your head as well. Okay? There she is. All right, and just hold it there for me for just a second. So now, we started at 0, okay? And then I take my measurement, right? Okay, so let's go back here for you to understand your stationary arm. Okay, axis through the acromion process, and my stationary arm is aligned to the greater trochanter. My movement arm is in line with the, which epicondyle? Lateral epicondyle, it's the one closest to me, okay? So lateral epicondyle. So it's going to be different than 0. Why? Anybody problem solve out for me why it's greater than 0? Why she's in some amount of hyperextension?
So it's resting behind where the trunk is?
Yeah, yeah, she's laying on the table. So if she was in line, it would be up here, okay? But she's not in the line of gravity. Gravity is actually pulling on her, plus she's laying on a table. So her range of motion is changed, okay? So I'm gonna have you guys find that lateral epicondyle, okay? And I'm gonna want you to give it a name, okay? So let's talk about how we name that if it's greater than. So it's more than 0, okay, beyond 0. What will it be? Positive numbers are on the upside of the line. Negative numbers are below that center line, okay? However, in this case, she's already going into hyperextension. So we're gonna call this a plus, because she's moving past the 0 and going beyond the range of motion, okay? So if I put everything in alignment here, and I use my middle finger to find my point of reference, okay? And there's her lateral epicondyle. So she is at +8, okay? +8. So then I'm going to have her move her arm all the way over to the top of her head, okay? Thumb coming over. And now I'm going to take it over here, okay? So, I'm lining everything up. Axis, AC joint. I don't have the AC joint exactly, but I remember my visual to the other side, okay? I'm still in line with her greater trochanter. And I started at the lateral epicondyle, but now I'm going to end at the medial epicondyle. So you can go ahead and find that. So she has +8 to 176, sorry. To 176. Okay. If I do it again, it's going to change. And if I do it again, it's going to change. Okay, because she's stretching. Right. So anytime we go beyond, it's going to be a plus. Okay. If we take measurements up here and we are short from 0 to the 180, that's when we would see that -90 or that -135, what have you. They're short from the full range of motion. Does that make sense? Okay. So whenever you guys are starting in supine position on the shoulder, you're probably always going to be beyond 0.
You said typically down here is negative, but we can use plus?
Typically when we talk about here, we think this is short of. I'm just saying, that's our logic, that's
Oh,
not in
okay.
scoring. When we
Oh,
look
okay.
at it, we go, well, it's short, we didn't get to 0, so that would be minus of 0, right? So that's how we look at, that's how we learn math, right?
Oh, okay.
Like, these things are below, so it's
Mhm.
a negative, but that's not how we use goniometry.
Oh, okay.
In the world of goniometry, when we go down here, it's a plus, right? So, greater than 180 degrees is where we're starting. Okay, so how many degrees more than 180? I wouldn't say she's 188 degrees. I wouldn't say, right? Because we start at 0 in this one. So it's plus 8 in this instance. To 176 is what she gave me. Right?
So how would you do, like your starting position is +8 and then the end is
Yep.
174?
And so, see on where it says shoulder, it says 0 to 180.
Mm-hmm.
Instead of the 0, you would put plus 8.
Okay.
So then if you were to document it the other way, I know we're not doing it in class, but with the negative, it would be -4 since you had 176.
Right.
So how would you document that additional 8?
So you would still put plus 8 minus 74 slash minus 74 or whatever, minus 6, whatever. Now when we take Goni measurements, there is an error that we're allowed to make of between 3 and 5 degrees. So if we come within normal range of motion between 3 and 5 degrees, then we consider that normal range of motion. Okay, that's the variable that we're allowed. So I measured her at 176. Okay, that's not within the 5 maximal degrees of variability. So I would write 176. Okay. But if she had 175, like 1 more degree, then I would say she has normal range of motion. Okay. And we allow that variability just for tightness of clothing, because we don't measure our patients nude, right? They don't always have on tank tops, etc. for clothing restrictions. So we allow ourselves those types of errors because of clothing, okay? All right. So she, for shoulder flexion, is 0 to 176. How do we measure shoulder extension? Okay. Shoulder extension goes from 180 back to 0. Shoulder extension, not hyperextension. That's a different measurement. Okay. So if we were measuring shoulder extension, then I would start her at this position. Okay. And I'm going to measure her here. Now our numbers are going to be backward. 176 going to 0. Okay. So again, I'm going to find my points, my axis, a line through the middle of the trunk to the greater trochanter. And then I'm going to start now at the medial epicondyle and then measure to the lateral epicondyle when we come back down. Okay, so it's just the reverse, right? So now I have 175. Okay, so she's here. Now we'll ask her to bring her arm down, palm down on the table, and then we're going to come back, do the prone process, to the greater trochanter, to her lateral epicondyle. What do we have, plus 8? Plus 8. Okay. Right. 0 to 180, 180 to 0. The chart you're going to be following is on 376. It starts at are all the range of motion measurements that we're gonna follow, okay, directly out of our book, okay? If we had 10 books, we'd probably have 10 different measurements. That makes me insane. They should all say the same thing, but they don't. For a good majority of them, they do, but there will always be some differences somewhere, okay? Elbow flexion differences, or what have you. Supination differences.
What page is it?
179. I'm sorry, 379.